Hello, we'd like to welcome you today to new developments in Nav-CARE, the Compassionate Dementia Inclusive Communities Toolkit. I'm Barb Pessett, and I'm a professor in the School of Nursing at UBC Okanagan. But before we begin today, I'd like to respectfully acknowledge that UBC Okanagan and the North Okanagan Hospice Society is situated on the traditional, ancestral, unceded territory of the Syilx Okanagan Nation. I would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. Before we begin today, I do have a few housekeeping details. The closed captioning should be on for you. To turn it off, closed captioning, select the Hide Captions button on your menu bar. We will be sending out evaluation forms after the presentation today, and we would so appreciate it if you would fill those out. That really does help us in planning future events. As we present today, please type your questions or your comments into the chat box, and I'll be reading those out at the end of the presentation, and we will answer and address your comments at that time. So today's event is a Research to Practice webinar co-hosted by the Institute for Healthy Living and Chronic Disease Prevention and the North Okanagan Hospice Society. I'm delighted to introduce our two presenters today. The first is Kelli Ashford, and she's a project manager for the EU Navigate project, which is an adaptation of Nav-CARE for 6 European countries. I'd like to also introduce Kelli Sullivan, who's the research facilitator in our Palliative and End-of-Life Research Lab, and she's leading an initiative in terms of building compassionate communities through Nav-CARE. So thank you both for being with us today, and we look forward to hearing your presentation.
Thank you, Barb, and good morning, everybody. We'd also like to acknowledge that myself and Kelli work at the University of British Columbia in the Okanagan, which is situated on the traditional, ancestral and unceded territory of the Syilx Okanagan Nation. And that we'd also like to recognise that the project that we're introducing you to today is also taking place in many other traditional territories across Canada, and we acknowledge our respect to those lands as well. So we're delighted to be here representing the Nav-CARE team, of which Barb didn't tell you that she's actually the lead. And we're looking forward to telling you all about the new and exciting project, which focuses on developing compassionate dementia inclusive communities. So myself and Kelli will provide you with an overview of the project, how it came together, the steps we're taking to implement the project, and finally we'll highlight the impact and outcomes that we hope to see in the next 18 months. So the idea for this project really came from observing the many wonderful initiatives across Canada that are designed to create more aware, educated, engaged and supportive communities for those living with declining health. And also from observing how these people, organisations and communities really come together to make a real difference in their communities, especially in the daily lives of those living with illnesses. Now, while these initiatives are making a really meaningful difference in the lives of many individuals, there are some people within the community for which these initiatives do not really meet their needs. So, for example, the persons living with dementia and their care partners. And this really highlights the urgent need for practical solutions to support these individuals so we can help them live their life to the full. We've also seen that interorganisational approaches to community initiatives are increasingly recognised as an important innovation, and that coming together can really help to build capacity and better support the communities that we live and work in. So, with all of this in mind, we've brought together 3 lenses: the compassionate communities, dementia inclusion, and volunteer navigation. And each of these have their own toolkits, which we'll bring together in order to learn how we might be able to better support persons in the community who are living with dementia. And in keeping with the theme of this interorganisational collaboration, we've mirrored this approach in our project team as well. So we've partnered with engagement specialists from organisations that have developed toolkits around each of these 3 approaches. Now, we'll take you through these approaches just to familiarise yourself with, so we can familiarise yourself with them. And so you can understand how they all weave together to bring about this project we're currently talking about. So we'll start with compassionate communities. So a compassionate community is really a group of people within the community who are passionate and committed to improving the experiences of those living with serious illness, caregiving, dying, and grieving. These community members typically take an active role in connecting with people living with chronic or life-limiting illness, their care partners and families, and they strive to raise awareness and build a network of support that really allows people to feel seen, supported, and empowered. The compassionate communities approach that we've drawn upon here is based on the work from the BC Centre for Palliative Care and the development of their Compassionate Communities Toolkit. And I'll just take you a moment just to give you a little overview of that. So the toolkit enables communities to identify aspects of their communities that align with these 5 ideals that are on the slide here. These are awareness and advocacy, attitude and commitment, leadership and capacity, networks and connection, and opportunities and recognition. And later on in the presentation, Kelly's going to speak more about these as she introduces the project in more detail and the steps that we're taking in mobilizing resources each community has. In helping with the process of identifying aspects of the community that meet with these ideals or that need to be developed, the BC Centre for Palliative Care developed the Compassionate Community Index Survey. It's an evaluative tool that can be used to identify areas of strength and development within these ideals, but also to evaluate new initiatives as they grow. So as you'll see, when we talk about the initiatives that communities might implement, they can use this index survey along the way to see how those initiatives are really developing and growing within the community. So by completing an assessment of the community, we're really in a better position to understand how each community supports those living with serious illness and to understand what additional action needs to be taken. And we recognise that each individual community is unique, and so the things we see in each community are going to be very different, and the approaches that they're going to take to promote various initiatives or identify initiatives that are needed are going to be very different. So let's move on to the dementia inclusion. So the number of people living with dementia is growing. There are about 76,000 Canadians who receive a new dementia diagnosis every year, and about 60% of those stay at home and are living with their care partners and family. And so you'll see it's really important to include and support persons living with dementia in their family and their families in the community, so they're able to journey through their illness as well as they can. The dementia inclusion movement, also known as dementia friendly movement that we draw upon, comes from work conducted in the Building Capacity in Dementia project. The project was brought together by researchers from the University of British Columbia and Lakehead University in Thunder Bay. And it also brings together community organisations, including Northwest Dementia Working Group in Ontario and the Westside Seniors Hub in Vancouver. And these organisations comprise people with lived experience, so they were really able to give insight in what it is like to live every day with a dementia diagnosis. The Building Capacities group came together around a desire for change. They wanted to contribute to research, challenge the perceptions of what it means to live with dementia, and to really make a change. The project aimed to develop and evaluate effective ways to create sustainable opportunities for people living with dementia and family and friend caregivers, so they may remain active and connected in their communities. They were able to take their learnings from the research and translate it into a variety of accessible media. And I've just put some of those outputs up here on the slide. And they were brought about to really raise awareness around dementia and provide pragmatic tools to help others support their communities in becoming more dementia friendly. And I just want to draw your attention to the Flipping Stigma on its Ear toolkit, which is down in the right-hand corner, which is what we've utilised in this particular project. It's a resource offering practical suggestions on recognising and responding to discrimination in all of its forms. And it's become a powerful vehicle with change within this environment. And it's been used for workshops in care homes, neighbourhood housing, community centres and volunteer training programmes, all of which we've seen yield really positive feedback. So the work that's been done within both of these approaches has really enabled us to better understand how we can more effectively support persons living with dementia and their care partners. And in looking at them in tandem, it's highlighted the synergies that we can draw between the both of them. So while the compassionate community approach and the dementia inclusion approach both have their own unique aspects, they really share a lot of common ground. That being that both approaches strive to support people to live well from diagnosis to death, whatever that may look like for each individual. That they're based on the idea that knowledge and autonomy are determinants of a higher quality of life. And when people are empowered, their sense of well-being and confidence really improves. They both capitalise on the fact that our communities are rich havens of resources, and both use a relational approach, sharing the responsibility of creating sustainable support rather than leaving that to rest on the shoulders of any one individual, any one organisation. And lastly, they both build on the set of common principles, and these being that communities really know their community best, that all people are empowered to use their voice, that all communities have untapped resources and energies that can be mobilised for an important cause like this one. And that when people are empowered with knowledge, skills and resources, we see that communities really are fueled to come together and act for each other. So the final piece of the collaboration is the volunteer navigation. And for that, we draw on the Nav-CARE programme. Nav-CARE focuses on recruiting, preparing and supporting volunteers to do the work that we've just spoken about. Some of you may have joined these presentations before and heard about Nav-CARE, and some may not. So I'll just give you a quick overview of the programme. So Nav-CARE stands for Navigation, Connecting, Advocating, Resourcing and Engaging. It's an evidence-based volunteer navigation programme where specially trained and mentored volunteers collaborate with persons living with declining health and their families, with the aim of improving their quality of life and enabling them to age in place at home or in a home-like setting. It's typically implemented through hospice palliative care organisations, although we're excited to be partnering with some health authorities and municipalities as well. And as you heard Barb say right at the very beginning, we've also got partners over in Europe as well. So this is really a worldwide navigation programme. When we refer to specially trained volunteers, we mean volunteers that are provided with competency-based training, with the purpose of being able to establish and negotiate the best fit between the needs of the person that they're working with, the family, the community, and available resources, in order to improve access and to promote quality of life, foster independence, and facilitate connections. When the volunteers go in to visit the people that they're working with, they're trained to ask, what's most important to you today? And this question really helps to focus the navigation activities on the quality of life concerns that an individual or the family might have. They're able to assist in navigating changes and that the needs that arise as persons seek to live long and well in their home. And it's really about developing a long-term relationship that has 5 functions: to provide early support in that illness journey and to really develop a strong relationship, to help with tasks that may be challenging to navigate, to find and connect persons to resources and supports within the community that might meet their needs, to just listen well and deeply as people make transitions and decisions that arise out of declining health, because sometimes all we need is just someone to listen to us. And finally, to provide a safety net for those living at home alone or without family nearby. And in doing all of this work with the persons they're working with, the volunteers are supported by a volunteer coordinator. And these coordinators are really important in facilitating both the matching process, so between the volunteer and the persons living with declining health, supporting volunteers as they develop those relationships, and also in connecting volunteers in order to create a strong community of practice. So how does Nav-CARE fit into this collaborative partnership with the dementia-friendly communities and the compassionate communities? Well, we know from work that we've completed since the beginning of Nav-CARE back in 2010 and from our partners that we work with, that volunteers are really pivotal to the success of the compassionate and dementia inclusive communities. They provide support, advocacy, and respite for persons and their families as they journey through the challenges of each person's unique illness trajectory. They themselves are rich sources of community knowledge. They support active engagement of people living with serious illness in the home, in the community spaces, and in long-term care settings by building connections and really fostering that compassionate community approach. They take on awareness building campaigns, for example, reducing stigma related to dementia, death, and dying. And they support and they're compassionate citizens themselves. They're engaged in cooperative relationships for the support of all of the people in their community. So Nav-CARE really provides the framework for recruiting, training, and mentoring volunteers, readying them to do this important work. And as an evidence-based program, it continually undergoes evaluation and development to address the needs of community and our growing population. And I should probably say our growing aging population as well. So to this end, the recent work that we've been being completed within Nav-CARE specifically explores the impact of Nav-CARE volunteers in supporting those living with dementia and their care partners. And that work's really showed that volunteers can make a real difference in people's lives as they navigate their dementia journey. They provide the much needed support, both emotionally and relationally, and develop meaningful relationships. And just the simple act of listening, they found to have profound effects. So as a result, the Nav-CARE training now includes a module specifically related to dementia. So this collaborative approach that we're taking is really pivotal in mobilizing the compassionate dementia inclusive community vision that we have. By working together, we really hope to reach more people, actively improving their well-being as they journey through the tough times associated with serious illness, caring, end-of-life situations, and grief, while simultaneously raising awareness within the community and creating a more compassionate approach, especially in the lives of those living with dementia. So I'll now hand over to Kelli, who will just talk you through the toolkit that we've developed that's going to help us realise this vision and how it's going to be implemented.
Thanks, Kelli. So toolkits provide a framework for organizations to use when implementing, say, a new practice, a program, or an intervention. So to translate the ideas we've been discussing about compassionate communities, dementia inclusion, and volunteer navigation, toolkits for each of these movements have been developed to help guide communities to make these ideas real and actionable. So these toolkits are the Compassionate Community Toolkit, the Building Capacity Action Guide, and the Nav-CARE Toolkit. So the Compassionate Dementia Inclusive Communities Toolkit, or the CDIC Toolkit as we call it, because that's much shorter and easier to say, brings together each of these three toolkits to help guide the practical application of creating a compassionate dementia inclusive environment. So in practical terms, this means that the CDIC toolkit is built upon a strong evidence base. It provides organizations with a 6-step approach to developing and implementing compassionate dementia inclusive initiatives. And so the steps include building partnerships, understanding your communities, preparing your volunteers, visioning and implementing a plan, evaluating initiatives, and sustainability. So I will take you through each of these steps so that you have a better understanding of the implementation topics that are covered. So the first step is all about building partnerships. We know that building capacity for compassionate dementia inclusive communities is done through relationships and collaboration bound by common goals. Organizational partnerships build momentum, synergy, and can provide safe ways for people to receive help while avoiding labels that might lead to stigma. So our goal throughout this project is to really engage as many partners as we can to build a compassionate, dementia-inclusive community approach to support those living with dementia as well as their care partners. So given that this project takes an inter-organizational approach, the core leadership team consists of 2 to 3 individuals, each representing their different organizations in the community, who commit to working together to implement the project work plan and related deliverables. The core leadership team will also be working alongside an advisory committee of key diverse community stakeholders. So in concrete terms, this means advisory committees will include persons living with dementia and their care partners, service providers from both the formal healthcare background and community-based services, representatives from municipal council and perhaps faith communities, as well as individuals from other agencies who can really influence supports for persons with dementia and their care partners. So the more the diverse group, the richer the dialogue and the collective growth. The first of the activities of the project, once the partners have been identified, is to take the temperature of the community in terms of understanding the community's strengths, as well as the opportunities for growth. So this is step 2 in the CDIC toolkit. So there are 2 ways communities will be doing this. The first way, they'll be using the information collected from the Compassionate Dementia Inclusive Community Index Survey, or the CDIC survey, and they'll also be conducting an environmental scan. So first, in terms of the Compassionate Dementia Inclusive Community Index Survey. So Kelli introduced this index survey briefly when she talked about the Compassionate Communities Toolkit. This index survey has been revised for the purposes of this project, and it outlines key ideals to inform and assist leadership in assessing the level of readiness and commitment to build an ideal, compassionate, dementia-inclusive community. So the index is made up of 5 ideals, which you can see on the slide here. And each ideal has 5 related questions that asks participants to rate how they feel. From 1, I don't know, to 5, we're there. So this will tell them about where their community currently is on the journey of becoming a compassionate, dementia-inclusive community. So in terms of the awareness and advocacy ideal, this looks at whether there are community-wide activities that raise awareness about dementia and end-of-life issues, and if there's a strong coordinated voice supporting the idea of a compassionate, dementia-inclusive community. The attitudes and commitment ideal explores how committed a community is to supporting persons living with dementia, caregivers, and those grieving by adopting the idea of a compassionate, dementia-inclusive community. Under the leadership and capacity ideal, respondents are asked to think about whether there's a dedicated organization, group, or individual that's leading the implementation of this work, including things like enlisting volunteers, partners and professionals, pooling resources, facilitating access to training, and coordinating activities. The networks and connections ideal explores whether there's an established neighborhood network that checks in with and monitors the changing needs of the community, and that there's a system that connects people to one another and directs them to helpful community supports, groups, and services. Finally, the opportunities and recognition ideal asks respondents to consider whether there are people in the community looking for and harnessing funding opportunities, innovations, and partnerships with other compassion-based movements, such as, say, the age-friendly communities movement and dementia-friendly environments to support dementia-inclusive approach for all. So essentially, the CDIC index survey really takes a snapshot. It's using perceptions of community stakeholders and the public, if the communities choose to include the public in that data collection. It helps the community function on strategies or actions for improvements and assists them in launching the community in action. And it can also be used to evaluate the new initiatives as they grow. And the second way for communities to assess the social and physical environment around them in relation to the needs of people living with dementia is by conducting an environmental scan. For example, let's say the community's index survey leads them to think about ways they can work on awareness and advocacy. An environmental scan has shown that there are few opportunities for persons living with dementia to be involved in community-based recreation programs, as they aren't always necessarily tailored to build on the capacities of persons living with dementia. So the community can use these two findings to help focus an intervention on something like an awareness raising campaign targeting recreation centers and programs to promote the inclusion of people with dementia in these kinds of activities. So together, these assessments can really give a clearer sense of the areas of strength and opportunities in the community and where they may focus on an initiative. And the other piece to this is having communities develop an inventory of local resources. Many of our Nav-CARE sites already do this. In this case, it may not be dementia specific, and so that could be another tool that they can use to understand their community. So in terms of step 3, Nav-CARE advocates for the systematic training because often volunteers receive little training over and above an organization's orientation. And it's important that they feel well equipped with the knowledge needed to navigate the complexities of working with persons living with dementia. So for step 3, the core leadership team in each community will look at the training that each of their respective organizations offers to their volunteers. This will help them to better understand what's being offered in terms of volunteer training across the partnership. Communities can then identify gaps and overlaps, which will help inform them what kind of training volunteers need. Minimally, all volunteers engaged in the project should complete the Nav-CARE training. The Nav-CARE education is comprised of 7 learning modules, and they have been structured around the evidence-based competencies that volunteer navigators should have to do this role well. So the learning modules include becoming a Nav-CARE volunteer, addressing quality of life concerns, creating community connections, advocating with persons and families, promoting active engagement, facilitating virtual navigation, and then supporting persons living with dementia. And we also want to point out that volunteers on this project can take on different kinds of roles and don't necessarily need to directly support persons living with dementia and their care partners, although this is certainly an area of service that we are building out as well. So for example, volunteer roles can take the form of participating on the advisory committee. They can help launch the initiatives that communities design. They can offer social media support, administrative assistance, and so forth. The results of the CDIC survey and the environmental scan will identify strengths and opportunities for growth that will be used to guide actions towards building a dementia-inclusive, compassionate community. Once there's an understanding of the community's assets and where the strengths lie, as well as areas that are underdeveloped, the core leadership team and the advisory committee will brainstorm the kind of event, activity, or program they would like to implement. As you can imagine, there will be a myriad of options and opportunities. The UBC team has suggested that one initiative focuses on awareness or education activities, and that the other initiative focus on enhancing or providing practical supports. So for example, awareness and education initiatives could be hosting a film fest showing films such as Still Alice or Father. Following the festival, the community could hold a public forum to talk about topics that arose from viewing these films. Or another idea might be to say advocate for a compassionate dementia inclusive community lens to be adopted in policies by municipalities, school districts, major employers, and unions. Examples of initiatives focused on the provision of practical supports could include developing a grief program for bereaved care partners, such as walking or an exercise group. Or it could mean developing a mobile creative arts program for persons living with dementia who are living at home. This could involve art making sessions, music making sessions, and poetry writing sessions. So while the CDIC toolkit we've created lists some suggestions like the ones I've just mentioned, we do recognize that communities know their communities best. Whatever the potential initiatives, we do need to think about how these align with the principles of inclusion of persons with dementia, ensuring that social and physical environments are created in such a way that persons living with dementia can meaningfully engage. So in terms of the principles of inclusion, there are some fundamentals that we want communities to keep in mind when implementing a plan to build compassionate dementia-inclusive communities. So inclusive programs are created in collaboration with persons living with dementia. They prioritize meaningful engagement over the course of the dementia journey. They're welcoming atmospheres where persons can find a sense of belonging and build relationships, nurturing and celebrating the small wins along the way. They're environments where persons can see themselves and witness examples of others living well with dementia. They're based on joint respite, where both the person living with dementia and their care partner has an outlet. They are dynamic and fluid, designed to be in the moment, focused on the unique abilities of the person living with dementia, acknowledging that no two persons are the same. And they're also educational opportunities led by persons living with dementia and their care partners that draw on their personal experiences. So when launching a community building initiative, it's vital to measure how well it's working. An evaluation plan helps answer questions like which aspect of your plan have moved your initiative forward? What has held it back? What are processes that could be improved upon? The CDIC research team at UBC will be working with community partners to develop evaluation plans specific to their initiative. We'll be thinking about evaluation in terms of a logic model that asks the following questions. So what's the goal? So what does the community want to achieve? What's the activity? So what initiative will you implement and try to help the community achieve this goal? What are the outputs? How many people will participate, for example, or how many events will be occurring? And what are the outcomes? So what change do you expect to see as a result of this initiative? While sustainability as a step occurs at the end of the CDIC toolkit, in actuality, sustainability has been very intentionally weaved into every aspect of the toolkit. So in this final step, we highlight the key considerations for building programs and initiatives with lasting impact. Our intention is to provide communities with a really clear understanding of the importance of each of the steps in this toolkit to the sustainability of the work that they're doing. And so what do we mean by sustainability in this context? So while the toolkit offers a conceptual model for communities to use in terms of how they think about and plan for long-term impact, in the simplest of terms, sustainability is the ability to maintain or support a process, its outcomes, and its impacts over time. It's really the ability to create lasting change. So some of the things we're asking communities to consider along this vein: does the intervention respond to a need or value expressed by the community? Does it extend the community's capabilities? Does it create change by combining community strengths with new knowledge and information? And does it deepen the community's ability to solve problems and innovate in a way that really creates lasting change? These questions really should be considered from the beginning, and they should inform the process all the way through. So finally, here's a list of the 6 organizations across Canada that are involved in this project. So since October, each of these sites has been oriented to the CDIC toolkit and are on their way to building compassionate dementia inclusive communities. And we really are looking forward to journeying alongside them and incorporating the learnings into a version of the toolkit that can be used by other communities who also aspire to improve support for persons living with dementia and their care partners. So to find out more about Nav-CARE, our partners and ongoing projects, you can visit our website, or please feel free to drop us an email. And we really appreciate you coming out today to hear about the work that we're doing, and we look forward to answering your questions.
Well, thank you so much, Kelly, and please do. Now is the time for your questions and comments. So please go ahead and enter them into the chat function there. And I see we already have some comments from patient partners, and I just want to thank you in particular for joining us today. And we would welcome comments and questions from you as well. So right off the bat, we have a question from Anna. Do you have any suggestions for grants that would support the sustainable implementation of this project? And I'll jump in on this one. Anna, thank you so much for that question. And we would actually like to acknowledge a contribution that we have from Health Canada that is supporting us and these communities in trying this new toolkit. But Anna, I would say that other possibilities are certainly a lot of the community foundations. There are a lot of not-profit foundations that are looking to support community-based projects. And I think a lot of that would depend upon what the community that you're from and who the foundations might be working with in your particular community. So we're certainly, if you maybe just enter, Anna, in the chat where you're coming to us from, we might be able to help you a little bit more on that. So as we're waiting for those comments and questions, Kelli, I'm going to bounce a few questions to you. So you're both involved in taking this project forward with these communities in some aspect. As you look forward to that, what are the things that you're most excited about in terms of doing this implementation with these communities?
Happy to start. You've got the Kellys. Happy to start, Kelli. I think for me, having worked on Nav-CARE in the earlier stages and developing those programs across Canada, I'm really looking forward to seeing how this looks in each community. Because of course, every community is different. Partners are different. Initiatives are different. And so I think really seeing how it evolves over time and how it takes shape depending on the community it's happening in. So I really look forward to that. And the other piece is, of course, a part of this process, we've created communities of practice. So for the communities to get together regularly to share information. And so I think just building those partnerships as well and seeing communities support each other along the journey will be, yeah, really, really fascinating.
Yeah, it's been really lovely to see the communities come together, and they're really flourishing with this project. And it's really exciting to see the passion that they're bringing to it as well.
Yes, thank you. Okay, Anna, we're back to your question here. We're in the West Kootenays, so thank you. The program is currently being implemented in Trail, but not the rest of the West Kootenays because funding is an issue. And yes, Anna, we find this all along in the development of Nav-CARE is that often we have to try a new approach. We have to get some evidence to support that approach, try out what it is that we're doing, and then make that available to other communities in terms of saying, okay, now we have an evidence-based program. We've learned whether this is going to work or not. We've made some revisions to the toolkit, which is our plan as we go along. And then, Anna, hopefully there'll be more opportunities within a year or two to find funding specific to this initiative. And certainly, Anna, reach out to us because there may be other opportunities within the West Kootenays in particular for other organizations that may want to support this alongside the Health Canada contribution. We have a question here from Cheryl. Would you recommend a faith community use the toolkit to begin discussion using the survey and the environmental scan, or would a presentation by Nav-CARE be possible to introduce the toolkit? Kelli, do you want to jump in on that one? Would you? So I think the question, what I'm hearing is could this toolkit be used as a launching point to really even begin the discussion around dementia-friendly communities, or would you begin from a Nav-CARE perspective? So tell me what your thinking is on that.
That's a good question. I think the piece that I appreciate about the toolkit is that I think it can take shape how a community wants it to take shape. I think it's got some fairly, again, evidence-based steps to ensure success in the best way we can. But I think it's quite flexible in terms of how it gets used. And of course, for us, the toolkit is still in draft form. We're just starting the project. And so the learnings that we accumulate along the way will inform a much more robust toolkit for sure. But I think in terms of how that gets used, I see it being flexible. I don't know if you have anything to add to that, Barb.
Yeah, I agree with you, Kelli. And I think we could go either way. One would be to sort of share that initial index survey that we've sort of modified, and certainly your community could start the conversation using that index survey because I think it's super helpful in terms of understanding what this could look like. Or, of course, we're also more than willing to do a presentation for your community as well. So I think, Cheryl, whichever way you would want to go on that one, we could certainly work with you and we welcome that you reach out. So Cynthia has a question. Has the Compassionate Communities model been used as a baseline in this new initiative? Kelli, Ashford, do you want to take that one on?
Absolutely. So we've taken these different approaches and really weave them together. And yes, Compassionate Communities is really come out as a foundation piece for the work we're doing. We recognise that there's lots of amazing work already going on that maybe people don't know about within the community that really sits within this compassionate community approach. So by taking the evaluation piece and people looking at their community through that lens, we're really able to establish that baseline level of readiness in the community and what's already being done, that so each of the communities can build on the strengths that are already there.
Thank you. We have a comment or a question from Shannon Paul Joes. Hi, Shannon. Nice to see you. Thank you for this great presentation. From the outline of the toolkit, it appears there is a community development approach to this work. That's exactly right. I'm wondering, has there been any collaboration with public health or population health? Shannon, that's such a good question. I'll take that one on because each community gets to decide who they want their partners to be. And so in each community, there might be a partner that's brought on from public health. And so, you know, we actually allow each community to decide who are the players that are most involved in this initiative right now, and who are we going to surround ourselves with as those partners. So yes, I can say for sure there will be some contribution from population health or public health. But again, it's going to depend on each community and who their most important, they decide who their most important partners are in that. Josephine has a question. Among the 6 participants, I'm curious what learnings were specific to long-term care homes. Either of the Kellys, do you want to take that one on, or should I jump in on that one?
So I
If
just
you
think
want,
just in the very initial stages of this process. So in terms of learnings, we're not quite there yet, I don't think, with the way we're able to move forward, but we're certainly interested in looking at the various organisations, including long-term homes within the community, that we might be able to provide support to, I think. And Barb, do you want to add anything to that?
Yeah, no, that's very true. I think we are still in the early part of the process, and I do know for sure that a number of our communities are choosing to partner with the long-term care sector. And so that, you know, they'll follow that process of that's been outlined in the toolkit of, you know, trying to decide who the volunteers are that are currently existing in long-term care, what training do they have, you know, if this is one of our partners, what do we think are the most effective implementation sort of strategies we want to choose. So for sure, long-term care will be involved in some of our communities, and we look forward to sharing what some of the findings are for those communities that are working specific with long-term care.
and
Barb,
Barb, I was just going to add the piece around Nav-CARE. Certainly with Nav-CARE, it's supporting folks living in community, living in home with declining health, but that also means long-term care homes. And we've certainly seen a lot of success with Nav-CARE volunteer navigators supporting individuals who do live in long-term care homes. So I anticipate, you know, having similar success with this project.
Good. If there are other comments or questions, please be sure and put them in the chat. Thanks, Josephine. Lise, Blanchette. How is that community-based long-term care? Our facilities and dementia patients are in the community waiting for support. Nav-CARE, I thought, was to support those families. Kelly, do you want to field that one? How is it that community-based long-term care are facilities? Oh, I see. Okay, thank you. I get this one. Okay, so Lise, we actually think about long-term care as a form of home care, and that this is people's homes. And so, you know, in the early days of Nav-CARE, we were really only doing home in community. And then many of our partner sites said, well, look at, you know, long-term care is a home-based type of site as well. And so for some of our communities that are implementing Nav-CARE, they have moved into long-term care because they are home-like settings. And what we've discovered is it's amazing how much navigation is really required even for those individuals who are living in long-term care. So it's really not just the social support that they get from having a regular volunteer, but it really is also that idea that there are all kinds of things that can still happen to keep people engaged. And the fact of bringing a volunteer in community is like bringing community into them.
Mhm.
And so that's been an exciting development in Nav-CARE, I would say probably in the last 5 years. I get it that the support is still valuable in that environment. Thanks, Lise, and thanks for that question,
Mhm.
that
And I think I
comment.
just add too, Barb, that with Nav-CARE, there's also support of the care partners and families. So I think that's an important piece to that as well.
Yes, yes, I think that's what Lise is saying. Thank you,
Mhm.
Lise. Good. Okay, I'm going to flip back to our panelists for a minute while we're waiting to see if there's any more questions and comments. And so now, as we, kind of we embark going forward on this initiative, I asked you what you're excited about. But, based on your experience in the NavCare program, Kelly, really for you for many years in the Canadian context, and Kelly, you now watching this thing unfold in Europe, what do you think might be the greatest barriers to envisioning this sort of community-based triple approach?
I can start, Kelly, if you want. We certainly tried to anticipate what some of those barriers might be based on our earlier research, and didn't add in the presentation, but we certainly have provided quite a few appendices with the toolkit. For example, draft tools of reference for advisory committees, job description, sort of tips and tricks, that kind of thing. But having worked in nonprofit for many years and in the research world, we know with research projects, timelines are tight, and in real world situations, things happen. And so with NavCare, some of the largest barriers really were around leadership changes. And so if somebody on the leadership team, stepped away from their role in that organization, as we know, hiring people, selecting, recruiting, training takes time. And so when you've got tight timelines, that certainly can be a barrier. Most of our communities in the past have already had really great partnerships in place. And so, that's been fairly smooth sailing for many sites, although sometimes the challenge can be building new partners, perhaps those partnerships that they hadn't had an opportunity to really develop in the past. So I think for me, it's the leadership piece and it's the timeframes. People are busy, and we understand that, and particularly in the nonprofit world, there's usually lots going on, and folks are under resourced. So I think that's what I would say.
Yeah, and just building upon that, I think you touched on it there, Kelly, just being very mindful of the workload of people as well. So we often hear that for the volunteer coordinators, they're not just responsible for one program, but for many programs, and they're each pulling on that person's time and commitment. And so really to share that capacity, or build the capacity for those coordinators, one of the things we've done is made that the leadership roles shared between 2 or 3 people. So we've taken the 3 partners together. They'll work together to really to see this program roll out. And I think that's a really important piece, because often people do feel overworked, should we say, sometimes.
Paul's got a comment in the chat here. The Kootenay Boundary Patient Advisory Committee and community has been working on engaging communities for education and navigation coordination, and has become a focus for some of our activities. Who should we connect with to discuss how our efforts may help you with your outreach to communities? Paul, thank you. Contact navcare@ubc.ca and we'll connect you to the communities, and we would just love your support. Thank you. That would be really, really helpful. Another thing we're quite excited about in this project is one of our sites is actually going to be Newfoundland, and one of the partners in Newfoundland is going to be family practice. And so, for a long time, as you think about bringing all of these partners together, one of the ones that we've really wanted to develop was this idea of working with physicians in family practice, knowing that they're often aware of patients and families who are struggling in the community. So we're very excited about bringing them on as one of our partners as well. Any other comments or questions? Okay. Well, if not, I think we're going to bring our presentation to a close today. I want to thank you again for attending and for your support today. I want to thank Kelli and Kelli for presenting, and there will be an online evaluation form that will be coming to you, so please do fill that out. I know the Center for Healthy Living and Chronic Disease Prevention uses that in many, many different ways. And so again, my thanks to you all today, and have a wonderful rest of your day.